the electronic medical record
Yeah.
vendor. There are no good numbers for them, but I will tell you
I think
that
that's purposeful.
that when Boone went independent, the previous vendor, I don't know how many I heard it was tens of millions of dollars to run their system. Wouldn't come down on their prices, even though it's already in there. This is just software at this point. All the hardware's there, right?
Right.
And we had to go to a different vendor to get a less expensive, I won't say cheap, but record system. I don't know how much they're charging, but it's it's yet another parasite on the system. And I'm going to talk to people about electronic records here. They will tell you, hey, at least you can read the prescription. They'll make fun of doctors' handwriting. Say, well, there won't be those errors, right? They'll say, hey, you've got all this information at your fingertip, right? Hey, you can submit your prescriptions here. Hey, hey, you can make sure you get your vaccines or your pap tests on time, right? Things that lists and computers are good at. But they don't tell you how it's the number one cause of burnout and physician frustration. They don't tell you that when you go see a patient, having 2,000 pages of records doesn't help you. You've got a few minutes to see somebody, and how do you get all this information together? They don't tell you that the EMR, which touches every aspect of patient care now, all right, was never tested. Every medical device you have, every pill you take, everything has been tested for efficacy, right? But when the Affordable Care Act went in, they gave these checks to bribe people to get the EMRs, right? They got insurance companies have bribed me and said, well, we won't even pay you unless you have an EMR, right? They never tested it. Supposedly these systems were supposed to talk to each other, but they've purposely been made not to talk to each other. You got to print and fax these things out anyway to send them back and forth and whatnot. I'm here to tell you that EMRs are just a disaster when it comes to morale and time. Like you may spend 5 minutes seeing a patient in the hospital. It'll take you a half an hour to try to take care of this computer screen, and it's horribly demoralizing. Right?
Well, and here's the interesting thing. I'm not going to per se blame EMRs. I'm going to talk about...
I will. I'll leave that up to me.
Not for EMRs. I'm going to say the deployment and how they were designed and built.
Right.
Because look, here, watch
Criminal.
this. Watch this. Woo-hoo. I have more computing power here than we used to launch the space shuttle.
Correct.
This makes my life simpler.
Right.
This summer, I went to go visit my son serving the military in Germany. I didn't talk to a soul. I sat in my bedroom after hours when I got home and took my last phone call, and I got my flight reserved. I reserved a home to rent all the way over in Farshant, just outside of Garmisch, and I did all this on that device.
And it was easy and convenient.
In every industry, IT is used to create better economy of scale, better efficiency, better ease of use, and to help you make better decisions.
The potential is there.
Potential. That's right. And that's what I want to say.
It's there, Troy.
I do believe that there is an opportunity. Here's the problem. The current architecture and the current design in most of our EHRs was built decades ago. It was built decades ago.
It's just layered on top of DOS. For those people not born yet, DOS was one of the original coding languages for IBM.
We're lucky right now that we're using the newest version of a particular product, and it's actually a cloud-based system, which is relatively new. But it still was built. To me, data capture is something that should happen in the process of following patient flow. Right? It was built for data capture. It was never built for flow.
Right. It's built for the government and insurance companies to find out what we're doing at the expense of the physicians and the healthcare providers, turning us into data entry clerks.
And if you say, okay, well, I don't have to do that in my institution because I use a scribe. Well, when you get to my donut, I'll blame it on a lot of other people because I'm biased towards my donut. I
have hired a scribe.
Yeah, absolutely. Because it makes your life easier and you can stare your patient in the eye.
Yeah.
I had this really cool moment.
Oh, we're saving all this money with the EMR, but I have to have somebody help me.
Right. And so to me, the thing that I am seeing is several years ago, and I won't name the brand, but I had an opportunity to go see a very well-known player in the healthcare field that did not normally build EHRs. They were not on that side of it. They typically make devices, CT scanners, MRIs. And they had this idea that, you know what, we're going to build an innovative EHR that is following the physician and the patient's footsteps.
Right. Did somebody bother to follow the flow, the workflow of physician in designing these things?
And so this was, and I saw some of the early versions of it. I'm not a provider. I'm not a physician. So I had no ability to look at it and go, yeah, that makes a lot of sense to me. But the fact that they were pursuing it this way told me two things. Number one, it's possible. And number two, they feel that others didn't really kind of follow that model. At all.
They said, how can we do billing? How can we get this information to insurance companies? How can we check these boxes? Right. And then the physician was an afterthought.
So I'm going to give credit, even though the previous vendor that you were discussing earlier, for Boone in particular.
I found they were an epic failure.
Something like that. Yes, absolutely. But the interesting thing is they've got a product that most people would tell you, hey, it's a really, really good product. But it's one size fits all.
And Arabic is a very good language, but you try to learn it.
Right, exactly. And so, but the issue with the whole deployment of that is their biggest expense really is not on the software side. They'll be the first ones to tell you that. They demand X amount of personnel to support the product. And my first thought was, wait a minute, you're designing a product that requires a ton of human intervention to be usable. Because most of the other things in my life, when you design a really cool product, it becomes simpler to use with less resources necessary. Right. And so the idea that we're going to make sure you have the service you need by building this, again, you saw me talk about my walls between the insurance company and health systems. If you have enough people to deploy to help support this product, it'll be this really, really nice working product. I'm like, well, how about build a product? I don't have anybody that follows me around to schedule I paid to park here today.
Okay.
Pressing a button here.
Little app.
Didn't have anybody that had to come and help me do that. Same device earlier, I paid a bill. Same device earlier, I answered a message from the hospital. I answered a message to my mother. I mean, all of that is here, but it's very simplistic to use. Somehow we've lost sight. Is there potential value? Absolutely. But we're not there yet. It's a tool that has become very cumbersome. Is it getting better? Better is a relative term, but I would argue it's better. But we have a long ways to go for it to reach the same level of interoperability that you see with any app you download to your phone today. Yeah. I've often wondered when the innovation is going to come, when people say, okay, we're going to have a platform-based product. Like, let's just use, I'll use, even though people have seen I'm using an Apple device. But imagine a world where an Android device has a base, quote-unquote, EHR, and then individual specialties can start developing, because physicians are incredibly inventive, and they can build a module that can then be used by other providers. And over time, let the market decide, well, what module should I use for endocrinology or cardiology?
Well, I think this is one of the cases where the government made it worse. And I'm not exaggerating. A colleague of ours a few years ago, he hung himself a couple hours south of here, and he was a hospitalist. And through the grapevine, I know he was very frustrated. And I'll tell you, I went to discharge with this epic failure I was telling you about that will not be named. I went to send a patient home. I saw him for 5 or 10 minutes. After about 45 minutes, I couldn't get the software to discharge the patient. Thank goodness I had a colleague come over. I was clicking on discharge, right? I had to double click on discharge. That's why it wasn't working.
Yeah,
you can imagine what that does to your desire to be a doctor. When I fear the computer at the hospital more than than working with the patient, right? I don't even want to admit patients to the hospital, Troy, for surgery.
Because it takes so
long, and it's such a frustrating process dealing with this goddamn computer rather than helping the patients that we're trained to do. And we see it as just a complete waste and a meaningless pursuit.
So I'm going to share a story. And I won't name names because I didn't ask her beforehand, but
sure.
The CEO of our product, which is Meditech, and we're very proud of it. The fact that they're trying to help us innovate around the product that they've done. Is it a ton easier to use? You use it every day and you realize it's not easier to use.
I think it's easier because it's simpler.
Okay, so it's a little more straightforward.
I find it much more straightforward.
But here's the thing, though, that's really interesting to me. She came in because she knew that we were in a stressful time. She took my entire team out to dinner and said, tell me what you hear about my product. I was sitting to her right at the dinner table. She was at the head of this table. Very, very kind person. Very proud of what they're trying to achieve. Not necessarily where they are today, but they were proud of the work that they had done. And I said, can we just talk candidly? And she said, yes. I said, my physicians use the expression click hell. Yeah. They just have click hell. They're clicking all the time. And her shoulders shrugged and she dropped her head. And I said, I'm sorry to have ruined a nice meal. And she said, no. Yeah. And she said something to me I thought was very interesting.
What was that?
She said, it was not built to be on a computer. She said, years ago when we started doing this development, she said one of our providers walked in that advises us, and he threw his iPad on the table and said, it will work on this. This is what I use today. This is where I touch and I swipe and I do things so much faster than typing a bunch of stuff, you know.
The retrofit
and so
made it less efficient.
He said, and so what she said was the entire plan was that it might be something that could be mostly device-based, because that's what you carry with you, right? Imagine if you could pull this out and you had your software for your office and then you had your stuff from the OR and all that stuff was right here.
And it's nice if you don't have bloody gloves on, but that's a whole other problem.
Okay. Maybe you need a scribe. Right. Maybe you need a scribe for that. Don't touch it if you got bloody hands. Let your scribe do it. But they had this vision of at least next generation. Let's start thinking about what are people using. I have optimism that the competitive forces in the marketplace are either going to do one of two things. A new product will come to the market that focuses on flow and efficiency, or one of the big three-ish, there's some close by, but one of the big three that are out there today are going to realize that there's going to be a massive market for the first one of them that can transform their product so that it meets those two demands. Because it will happen, and I would argue that in terms of generational healthcare is not known for great innovation, because evidence-based medicine sort of sets this idea that continuation of learning takes time and proof and evidence. I'm glad it exists, but I think it even creeps into products like this that, you know, you put in an EHR and 10 years later you're using a newer version, but it's essentially the same EHR. I think in short order, my guess would be, and I would forecast, that one of the big providers is going to say, I'm not going to allow myself to look and feel like the others. And I think we're going to see a transformational moment.
I hope they're listening, Troy.
I know listening. One is, because I talk to them frequently.
I hope they're listening.